Hi, everyone. My name is Megan. Today, I'm going to be talking to you about my practicum experience working in student affairs at Camosun College. So Camosun College campuses are located on the traditional territories of the Lekwungen and Wasanich peoples. I just want to begin by acknowledging their welcome and graciousness during the time I spent learning on their traditional lands. At Camosun College, the Office of Student Affairs strives to provide programs and services to support students' changing needs, including academic and career guidance to prospective students and assistance with the personal and educational goals of existing students. The student affairs staff and faculty aim to support student learning and development in a holistic and collaborative way. During my practicum, I worked primarily with the Office of Student Support on the Sexualized Violence and Misconduct Policy and Awareness Week, and I worked on the Mental Health and Wellbeing Strategy Research and Review. So my role during my practicum included taking part in the Sexualized Violence Awareness Week on campus by hosting information booths to conduct student outreach and spread resources and information regarding student supports that are available on campus. I was also a member of a task force reviewing the college's current sexualized violence and misconduct policy. I had the opportunity to research other policies in post-secondary institutions across Canada to compare Camosun's policy and put forward potential amendments. I was also tasked with facilitating feedback sessions from the students at Camosun to ensure that their voices and perspectives were included in that review process. Another aspect of my job was to take part in the review of the efficacy of the student mental health and wellbeing strategy at Camosun, which has been in place from 2016 to 2020. I did this by gathering information from students and faculty to gauge the degree of completion of each of the aspects of the strategy. This information will be used to form a new strategy for the college community going forward. For my practice scenarios, I identified that there is a need to incorporate Indigenous health strategies in order for the student mental health and wellbeing strategy to be comprehensive and effective for the entire student body. I also identified that there was a need to incorporate the students' voices in the review of the sexualized violence and misconduct policy to ensure that that policy is meeting the needs of all parties concerned. During my practicum, I called on the skill of health policy development and implementation while working on the sexualized violence and misconduct policy because I was required to research and implement amendments to the policy. Inquiry analysis of public health strategies was also a new skill for me to use while reviewing the student mental health and wellbeing strategy because I needed to review the current strategy and analyze the level to which the strategy objective had been met. I also used the skill of knowledge translation and communication in a professional setting by taking part in on-campus activities for health promotion, such as the Sexualized Violence Awareness Week and hosting information tables regarding mental health and well-being to promote the Canadian Campus Wellbeing Survey. Having a solid foundation of learning in the skill of cultural safety and competency due to my area of focus being Indigenous people's health was particularly helpful during my work on the student mental health and wellbeing strategy. Because it was through this training in identifying where there may be a potential lack of cultural safety that I was able to identify a gap in the student mental health and wellbeing strategy in terms of Indigenous health and wellbeing. One of the values that I believe guided my practicum was partnerships with people and populations served. This was apparent through the face-to-face meetings I had with key partners in the student society, as well as the many in-person information table events I hosted to connect directly with students and hear their concerns firsthand. The very nature of this practicum placement required that I incorporate the value of community-based approaches to research and knowledge development. All of the research and work that I did was conducted through a lens of how it was impacting the college community and how it could be improved for the well-being of the community. The value of interprofessional and multidisciplinary approaches to research was also integral to my work. I worked on the violence and misconduct policy task force with a mix of directors, faculty, staff, student society members, and security workers even, to review the policy and create meaningful and necessary changes. I also had to conduct research for the student mental health and well-being strategy by requesting feedback and information from members of the Camosun community in a whole variety of different professions and disciplines within the college. During I chose to focus on the Truth and Reconciliation Committee's call to action. We call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. Through my work on the student mental health and well-being strategy, I was able to draw attention to the lack of Indigenous traditional healing practices within the current strategy and highlight the need to remedy this going forward. So in order to address this call to action, the student mental health and well-being strategy must recognize the value of Indigenous healing practices and make them available to Indigenous students on campus. I plan to operationalize this call to action in my chosen after graduation by approaching any position I may work in through a lens of Indigenous people's health. I will advocate for the incorporation of Indigenous ways of knowing and healing into every aspect of the work that I go in to do, and I'll work towards supporting these initiatives if they're already existing in the organization. One of the most valuable things I'll take away from this placement is the knowledge of what a job in student affairs can entail and how well the skills and values I've developed throughout my time in the PHSP program translates into this role. I didn't even realize that everything I was learning with regards to determinants of health, reducing health inequities, and multidisciplinary teamwork would be beneficial in a position in student affairs at a post-secondary institution before this practicum placement. I was able to draw on the skills and values of the program to help guide me in my learning and contribution during my practicum, and I've had an amazing practicum experience because of this. I was really lucky to be surrounded by an awesome group of coworkers and supervisors who supported my learning at every stage and made me feel welcome from the very first phone call. This placement was a perfect culmination of all of my learning during the program, and I really hope to continue growing and building on this foundation for the rest of my career. I just want to say thank you to Jenny, Evan, and Stephanie from Camosun, and to Natalie and the other instructors at UVic for all of the guidance and encouragement, and my classmates and family for all of your support.